First at 6 o'clock, up-to-the-minute developments in the coronavirus outbreak.
Preparedness does not mean that we will stop the virus. It means that we will be prepared.
Late today, the death toll in the United States jumped to 6. All of those deaths are in Washington state. There are currently 91 cases reported in 10 states. And right now, Connecticut has no confirmed cases, but that is expected to change. We have team coverage for you tonight. Channel 3's Susan Raff is covering how the state is preparing. And Mike Savino is looking at plans for handling all the college students ordered home from all those study abroad programs. Let's begin with Susan. She's live at Hartford Hospital. Susan?
Dennis, Hartford Hospital has certainly treated patients with infectious diseases, and now the hospital is bracing itself for the coronavirus. Today, the U.S. Surgeon General came to Connecticut to get a closer look at what Connecticut is doing, and at this point, he feels that Connecticut is doing its best job to be prepared.
Or had travel history to an affected place. We've now expanded that criteria to...
U.S. Surgeon General Jerome Adams got a tour of Connecticut's public health lab. Testing on the coronavirus started Friday. Adams says people should be prepared, but not panic.
The risk to individuals from novel coronavirus right now is low. Why is that? Well, we know that risk is correlated directly with exposure. You can't get the coronavirus if someone around you does not have it.
The Surgeon General met with Governor Lamont, Senator Richard Blumenthal, and state health officials.
Our state lab has been approved as of Friday to do the testing for coronavirus, also COVID-19. As a result of that, this weekend we did 2 tests for persons under investigations, and we're happy to report that those individuals were negative.
However, now that the virus has been detected in neighboring states, Connecticut could be next. If that happens, health officials may decide to cancel large events and possibly close schools.
And if we're prepared for that threat, in turn we're preparing for the coronavirus itself.
Keith Grant is an APRN. He is the Senior Director of Infection Prevention at Hartford Hospital.
Simple hand hygiene, ensuring proper vaccination, definitely getting educated through sources such as the CDC. There's memos that come out through Hartford Healthcare that's available on our website as well.
The coronavirus is definitely taking a toll on people's health, and it is becoming quite expensive. We wanted to know, as far as Connecticut goes, what the testing is costing. We asked the Department of Public Health. We are still waiting for those numbers. But on a national level, Congress is asking for about $8 billion. And as you can imagine, the scare, the panic, even though the U.S. Attorney or the Surgeon General is urging people not to, people are concerned about traveling. And many students are being called back from trips that had planned. For now, we go live to Mike Savino, who's in New Britain at Central Connecticut State University, where students are definitely being impacted by the coronavirus there.